according to NHS estimates, 1 in 6 UK pregnancies will end in miscarriage. Although post-mortem examination can provide critical information for bereaved parents and for medical researchers about why the baby died, relatively few parents consent to post-mortem. Our research on the use of MRI scans in post-mortem has challenged taboos, changed clinical training and practice, and led to better support for bereaved parents.
So after Bo passed away, we never really knew what happened to her, but we learned so much from this project about people who would have cared for her.
My name is Kate Reid. I'm a Professor of Sociology at the University of Sheffield. Working with sociologist Dr. Julie Ellis and radiologist Dr. Elspeth Whitby, we have been exploring the development of minimally invasive post-mortem using magnetic resonance imaging, or MRI. The research revealed several issues about the experience of post-mortem. Professionals felt inadequately trained and unprepared to ask parents for post-mortem consent, while parents felt overwhelmed by information and were concerned about what would happen to their baby during post-mortem, particularly fear over the invasive nature of the autopsy. Parents felt discouraged from consenting, but also often experienced feelings of regret about not opting for post-mortem. The research concluded that professional practices around consent could be improved and access to MRI provision widened, and that hidden care practices in the mortuary that are unknown to the public, such as bathing, dressing and talking to the babies, need to be made visible to parents considering a post-mortem.
I think one thing that Ben, my husband, and I really loved was that people would sing to Bo while she was there. And for us that is beautiful and what we would want. And you know, we just heard so much about how people would talk to her and would care for her, and they were the things that we couldn't do at that time. And we know that there has to be a procedure that's followed, but just the real genuine love and care that Bo would have experienced really meant a lot to us. And I think if we hadn't have been part of this project, we would have never have known that.
Changes in professional training and to parent information sheets have already started to have an effect across Sheffield, and take-up for minimally invasive post-mortems is currently increasing in the region.
The research is allowing more parents to consent and is encouraging more parents to consent. But for us as the clinicians and the scientists, we can develop our understanding of what's happening that's caused the death and our further understanding if there's been any interactions with medications.
We displayed many aspects of the findings in an art exhibition called Remembering Baby, which showed in London, Sheffield, Northumbria and Nottingham. The exhibition included memory quilts and memory boxes, parent artwork, sound art, and a video based on interview data.
It's something that we know is very, very important for families to build new memories, to give meaning to their baby's maybe very short life.
The research team also ran creative bereavement support workshops, a model that is being adopted by other NHS trusts and national bereavement support charities. It really has touched so many people's lives that they feel very strongly about the project. And despite the sadness of the topic, everybody that's got involved has fallen in love with it because of, you know, it's a source of support and comfort.